welcome to the next episode on Researcher Revealed. This is the podcast where we go behind just the name that is listed on the paper or the contents of paper to get to know a little bit more about the researcher behind it, why research and why that subject. On today's episode, we have the second ever Canadian researcher who's joining us. Well, he's not Canadian. He's based in Canada at the minute. He's true global rising leader in nurse research. His name is Oluwadamilare, and he's currently based at the University of Alberta. And I'm excited to dive into his journey because he has started from Nigeria. He did a PhD in Hong Kong, and he's now based at the University of Alberta in Edmonton, Canada. So I hope you enjoy listening to finding out about how he's progressed through research. Hello, and welcome to our next episode on the podcast, Researcher Revealed. I'm Dr. Rosalind Austin, and today I have a guest joining me all the way from Canada via Nigeria and Hong Kong. Is that correct?
Yes, it is.
Very good. We have with us today Dr. Oluwadamilare. And he is going to share with us his research journey. And he's told me that I can call him Dami, which I'm very grateful for because he's got quite a long name that I personally struggle with because it's not familiar to me, but I love it. So can you introduce yourself to everybody, please?
Okay, thank you so much for this invitation. My name is Oluwadamilare Akingbade. I'm a community health nursing specialist, a certified global nurse consultant, and a postdoctoral researcher at the Faculty of Nursing, University of Alberta, Edmonton, Canada. And I'm so glad to be with you today.
Thank you so much, Dami. Can I ask you a bit of a personal question before we go forward? Does your full name have a meaning? I love finding out about people's names.
Yes, thank you. Nigerian names have a lot of meaning. For me, Oluwadamilare means that God has justified me, right? Yeah. God has justified me. While Akingbade means the valiant has gotten the crown.
That is so much better than the name of my meaning, because my name just means beautiful rose. It's nowhere near as cool. Perfect. Thank you so much for being willing to join us today. I really, really appreciate it. This, for everybody who might be just joining the podcast, this podcast, Researcher Revealed, is all about going behind the name that you just see as an author on a paper or at a conference proceeding or something like that, to get to know the individual and why they got into research. Now, for everybody who's listened to all of the previous episodes, they know the first thing we always do is we start with what I like to call the Rapid 11. Are you ready, Dami, for the Rapid 11?
Yes, I am.
All right. Are you a Windows or Mac user?
A Mac user.
Oh, you are extra special so far. Most of the people that I've interviewed or had on the podcast, I should say, everybody's Windows. So you are among the select few. Very cool. What about drink? Do you drink tea or coffee?
Tea.
Tea. Any particular kind of tea?
I like Milo.
Milo. Oh, I've not heard of that. I might have to look that one up. I love tea.
Okay.
I love tea. When you are writing, do you prefer to write in silence or have music in the background or sounds? What do you like around you?
Well, it depends on the level of writing. If what I'm writing is a bit doesn't require much thinking, and I write with music, just soft, solemn music. But if I have to do a lot of thinking, high level writing, I prefer dead silence.
Oh, nice. I like the hybrid plan. That's really quite cool. I've been exploring silence writing
Okay.
recently because people who I've spoken to on the podcast have inspired me to do that. And now I'm finding I actually quite like it. So, yeah,
Okay.
quite cool.
Yeah.
What time of day would you say you are most productive? So not like exact hour or minute, but like morning, evening, night. When would you say you're most productive?
Morning, of course. Morning.
Morning.
Yeah.
So mid-morning, early morning.
Let's say mid-morning. Yeah.
Okay. Okay, nice.
Yeah.
Very cool. And when it comes to putting the references in a paper, what is your favorite like referencing management system or program?
Yeah, I've been using Mentally for a while. I started using it when I was back in Nigeria because it's free.
Oh.
And I did not have access to EndNote and others. So when I moved to Hong Kong, I had access to EndNote and other reference managers through my institution, and I still
Mhm.
do now. But I've been used to Mendeley, so I just stuck with
So
that.
Mendeley is the favorite.
Yes, it is.
Nice.
Yeah.
Very cool. And when it comes to things like making your graphs or your figures, do you have a favorite data visualization tool that you use?
Not really. Not
No?
really. I just use any that comes along. Yeah.
You use what?
I use any that comes along and I find around. I don't have any specific one I have to.
Okay, okay, okay. I thought you were like, I thought any.com was like maybe some sort of
No,
special thing. And
no,
I'm like, ooh,
no,
that
no,
sounds interesting.
no.
Fair enough. And do you have a favorite desk snack to eat while you write?
Yeah, I love meat pie. I'm not sure if you know that. Yeah.
I've heard rumors of the infamous Nigerian meat pie, but I've not yet been fortunate enough to taste it.
You need to
Um,
try it.
but I have heard about it.
Yes.
I'll definitely put it on the need to try food list.
Okay.
Perfect. Thank you. And when it comes to like planning or organizing, whether that's like your life or a project or a paper, are you a digital organizational tool person or are you a pen and paper person?
I prefer the paper. I've been used to writing on paper over the years, so I love to plan on paper. Yeah.
Me too. I do the same thing. I have journals that I keep
Okay.
where I write every week and then potentially every day, like what I want to achieve and how like things to do and whatnot. So I'm a pen and paper person as well. So
Yeah, that's great.
what book are you currently reading? Like,
Okay, I'm reading the 21st century, the book of the 21st century business by Robert Kiyosaki. The
what
21st century business by Robert Kiyosaki.
what I will ask you to do because I have started creating um, a list from everybody who's been on a book of what they're like list of books that they're reading. And one of my hopeful future plans is to actually create like a virtual library of what researchers read. So if you
Oh,
can send me the title and the author, I'm going to add it to that list, as well as for everybody out there, if you want to read what Dami's also reading, in the description of the episode, you will find he is on social media, a bit more about his bio, some of the links to some of the papers that he's written, as well as the book that he's reading. So definitely check that out in the episode description. Perfect. Thank you. Last question on the Rapid 11. I told you they weren't hard. Is who is a researcher who you admire?
I have a lot of them. I have a lot of them. I really admire my PhD supervisor,
Okay.
Professor Kaming Chow.
Okay.
Yeah, yeah.
I think that is a very common experience that especially if you're fortunate enough to have like a really aspiring supervisor and you build a really good relationship. A lot of people who I've spoken to, and I'm the same, like my research hero is one of my supervisors.
Oh, interesting.
So it's not that unusual.
Yeah.
Thank you so much for letting us know a little bit more about you. Um,
Okay.
I wonder if you would tell us, so you are a nurse by background, you said, a community health nurse.
Yes.
How did you find out about research as a career?
Thank you. Research for me has been part of me since I was very young.
Oh,
Yeah, I used to be very curious about things. I love to question the question. I love to move out of my space to explore things around. So I think that has been a quiet trait in me. And eventually, when I entered the nursing profession, I got inspired by my lecturers. One of my lecturers that taught me research, Professor Bayo Lawal Ajibade at Lautech. That's a university in southwest Nigeria. He really made research fun. The way he taught,
oh,
yeah, the way he taught us, and from that time, I also have a very deep interest for academics. I wanted to be a lecturer from since I was young, actually, because
oh.
my parents, yeah, my parents are teachers, right?
Ah, so
So
your parents, did they teach university level or pre-university?
my mom taught in secondary school. They are
Okay.
retired now,
Yeah.
and my dad taught at College of Education.
Oh,
Yeah,
nice. So
yeah.
they inspired you to follow the academic pathway.
Yes, yes. So I grew up seeing them mark scripts, teach, and I fell in love with what they were doing at that time, and I was interested in moving in that path. Now moving on, when I got to Lautech, and I started observing nurses, how nursing profession is. I my passion for academics now combined with research, I got to know that if I want to get to the peak as far as nursing is concerned in the academics, then I need research, right? So that was a major motivation for me. And I also saw how research has been used as a tool to improve practice and change the way things are. And I always love to contribute to knowledge. I love to impact my world. And this is how I eventually found my path in research. And moving ahead to my master's, I did my master's at University of Ibadan. That's the first university in Nigeria.
Oh,
So getting to this university, I now had exposure to higher level of research. I see how my professors have gone around to different countries to present. Yeah, they actually have gone. They went around different countries, and as a younger nurse, I've always wanted to also explore the world. So seeing my
ah,
lecturers move around the world through research really inspired me, and I promised that I'm going to do this too. And that's where I got the passion. Yeah.
wow. So it's really then the influence of those people who are ahead of you, those lecturers, those even in your family, like those people who kind of exposed you to it. So you were fortunate to have that in your life.
Yes.
Okay, so that's how you got into research.
Yes.
Now, and like you've identified within an academic career, if you're going to go to the higher levels, and it's regardless of whether you're a nurse or lots of different specialities, you need to do research, you need to get grants, things like that. So
Yes.
that then means a PhD. Now, what I found fascinating about you when I was getting to know you a little bit, is that you made a really huge leap and you went from where you did your master's in Nigeria to Hong Kong.
Yeah.
So tell me about that. Like how and you went on a full scholarship as well. So how did that evolve? And then I've got like a million questions about doing a PhD in Hong Kong. So
Well, thank you so much for this question. PhD in Hong Kong is one of the major milestones in my career. I'm really grateful for the opportunity. It started when a friend of mine by name Dr. Tola, at that time she was in the university, in the Chinese University of Hong Kong for a PhD. She was in
Yeah.
her first year, and we were together at Lautech, where I started my nursing in Nigeria. Um, so she did a master's in Thailand, right?
Oh,
Yeah.
wow.
And she went after masters in Thailand. She went to Hong Kong for PhD. So we just got talking at that time. And she told me about the university, that you like to try this out and things like that. And it's really, when I saw the ranking of the university at that time, I think the Chinese University of Hong Kong was, I think, 21st or 22nd in the world. It was the first in Hong Kong, first in Asia. So it's really, I was really inspired, and I applied, and I got the funding. So before I left, the university is now first in Hong Kong, first in Asia, and the 16th in the world. And I was really exposed to high-level research. I've always wanted to do research at a global level. I know that I want to get to the peak of research in nursing, and I want to learn from the best. I want to be exposed to resources, facilities that were not available for me at that time in Africa, and this really inspired my move to Hong Kong.
Okay. So that's why you went to Hong Kong. Now, doing a PhD in Hong Kong, was it in English or did you have to learn the language as well?
Oh, it was in English.
Okay.
Actually, Hong Kong was colonized by Britain,
Well,
so
no,
Hong
no,
Kong.
I realized that, but it's still like, although English is a very common language there. The reason why I asked is I've recently, about a year ago, I'm doing a postdoc in Norway,
Oh, great!
a postdoc position in Norway.
Wow.
And similarly, while everybody there speaks impeccable English and my role is in English, there are certain things. So, like in a meeting, we'll all be sitting around, and as is natural and normal, if something comes into somebody's head, it will come out in Norwegian,
Oh.
not English. They'll then translate it for me. And like they're so kind and so lovely and so generous around it. But it's really inspired me to try and learn Norwegian in order to better understand the culture and stuff. So that's why I was more asking the question, is because
Okay.
even though I assumed, and from reading your stuff, your publications and stuff, I assumed it was likely in English, but there's especially, so how many years were you there?
I spent 3.5 years.
3.5 years, quite a while. So I'm sure you
Yes.
picked up some.
Did I? I'm actually not good with languages, so I find it very difficult, right? So I actually did not pick many, just little, very little. Though
Yeah.
when we go to the market to buy stuff, we interact, so we need to actually communicate, but in the language Cantonese. But
Yeah.
the many stores there, they've actually translated many of the things you want to buy. They put the price in Chinese, in English too. So that made it really easy. Hong Kong is called the city where East meets West. So there is a
Oh,
blend of Eastern and Western culture in Hong
nice.
Kong.
I
Yeah.
just, I'm fascinated. Like it's one of the reasons why I was so excited to reach out to you and have you as a guest, because there's not there. So the research world is quite small, especially
Yeah.
within nursing.
Yeah.
And then again, within nursing, the individuals like yourself who are aiming to be global researchers, again, that gets even smaller. And so, having seen that you've been Nigeria, Hong Kong, and now Canada, which is where I'm from originally, I was like, oh, I can't wait to talk to somebody who's as Is it crazy? Is it brave? To jump countries
Yeah,
in order to continue your pursuit in research. So that's sort of my reasoning behind my question. Okay,
yeah,
so PhD in Hong Kong in English, but still learns a bit of Cantonese.
yeah.
3.5 years. So that was a full-time PhD. What was it in? What did you end up studying?
Okay, thank you. For the PhD, I worked on digital health and oncology nursing.
Ah, I love digital health. Anyway,
Oh,
continue.
great, great, great. So I developed a mobile application to provide psychoeducational support for Nigerian women with breast cancer receiving chemotherapy. So that was the focus of my PhD research. Yeah.
Okay. Now, when you say you developed it, was it the constructs that you developed and you worked in collaboration with like a software engineer, or were you doing the software development as well?
No, I did not develop the software. I developed the content and the intervention.
Okay.
I coordinated a team actually. It's a team of researchers, a team of technology experts, and also nurses too. And so
Okay.
we collaborated together to develop the mobile application.
Very
Yeah.
cool. So developed the application, and then did you test it? And if you tested it, did you test it in the Nigerian female population back at home, or did you also test it um, in Hong Kong?
Okay, so the research actually, though, I was at Hong Kong for 3 years, and though the practice in Hong Kong at that time is that people doing PhD, many of them will actually go back to their countries for data collection, but due to COVID-19 issues and movements, so I stayed in Hong Kong the 3 years, but my research setting is in Nigeria. So
Okay.
it was really tough because of the time difference between Nigeria and Hong Kong. But I collaborated with research assistants, co-investigators in Nigeria. So it was tested. The app was tested among the Nigerian population.
So you had a real, like a lot of people doing their PhDs during COVID, you had a real rapid introduction to actually virtual digital health research development.
Yeah, yeah.
Very cool. Okay. So I want to come back and dig into your research a little bit more, but just to finish off your research journey. So you
Okay.
completed your PhD through all the complications of COVID, still managed through virtual networking to implement that application in Nigeria. And then now you've moved to Canada?
Yes.
Okay,
Yeah.
so tell me about that jump.
Oh, okay. Thank you. Okay, this goes way back many
Okay.
years as a young child. I've always wanted to be in the West, right? I've always wanted to be in the West, majorly Canada. So it's been like a childhood dream,
Oh,
right?
wow.
Yes, yes, it's been a childhood dream. So it's always been at the back of my mind, even while I was in Hong Kong. So around the time I was completing my degree, PhD, I think that was around November 2022. My final defense was in June 2023.
Yeah.
So I told you about a colleague of mine that shared the opportunity for me to come to Hong Kong,
Mm-hmm.
right? So the same colleague, after she left Hong Kong, she came to Canada.
Ah,
Yes.
she's a good woman to know.
Yes, she is. She is. So she is currently a postdoctoral researcher at University of Waterloo in
Oh, okay. Yeah.
Canada.
Yeah.
Yes, yes. So around that time, she moved to Canada as a PR, but she was still looking for a postdoctoral position. So it was not like myself that I got into Canada through my postdoc. She came as a
Okay.
PR and was searching for a postdoc. So while she was searching for a position in Ontario. right? But along the line, she saw some other offers, and she found this offer, Alberta Innovates postdoctoral fellowship. So she shared it with me. That time I was really busy, neck deep in writing my thesis, completing my data analysis. The last thing I wanted to do really was apply for any offer. You know how demanding an application for a postdoctoral fellowship
Yeah.
can be. So I had to muster the courage, combine that with writing my thesis, worked on my CV, developed, and reached out. Okay, I reached out to a potential supervisor. She is working on digital health at the Faculty of Nursing, University of Alberta, and she was excited to actually talk with me that time, and she supported my application, and here we are today. Though it took a long period, the visa processing and all took time, but I eventually moved towards the end of December 2023.
Okay.
Yeah.
Nobody warns you, do you? Do they? Like you spend so much time during your PhD, like working towards like finishing your thesis, doing your viva, your defense, whatever it's called, but nobody actually gives you a heads up and says, right, we're not going to tell you this. It's just going to be an extra fun surprise that while you're, like you said, neck deep in the final analysis and wrestling with like all the final stages of doing a PhD, they're like, oh, you're stressed, you're exhausted, you're done. So how about for a little bit more fun, you can now apply for a new job? It's just like this Brucey bonus of delight
Mm,
at the end
mm.
of your PhD.
Yeah, yeah. That's so true. That's really true.
And okay, so before I move to ask you a little bit more about why you're researching what you're researching, um, just what you already talked about how for you your aim and goal is to be a globally recognized reputable nurse researcher, so that therefore I now can see and understand why you've basically almost circumnavigated the globe now. But what would you say, reflecting back on those different experiences, were the real benefits that you gained from making those huge leaps, aside from the fact that you've got that on your CV, but like to how you view the world, how your research is viewed, just a few little like highlights as to maybe try and inspire other people to be as brave as you were, to do that.
Okay, thank you so much for that question. Reflecting back, I think a major benefit for me was an opportunity to view the world from various lenses, to
Okay.
see how people from different cultures, how they live, how they work. So it was really inspiring. I didn't know much about Hong Kong before I moved to Hong Kong. At that time, I was working in a very busy setting in Nigeria. So I didn't really
Okay.
have much time to ask questions. In fact, I remember the second day on getting to Hong Kong, I noticed that the drive was different. The side drive was different from the one in Nigeria. It was really shocking to me, and a host of other things, the food and other things,
Mm.
really. So I got to see another aspect. That was actually my first time of leaving Africa, second time of leaving Nigeria. So moving out of Nigeria and Africa gave me an opportunity to see the world from another perspective. Another angle is to the research I do. Due to the fact that Nigeria is a low and middle income country, there are some things that are not available to us in Nigeria when it
Okay.
comes to tools that we
Okay.
should use for research. For example, in my first year of my PhD, I remembered I was to do a systematic review.
Mm-hmm.
And that was the very first time I was exposed to searching different databases. Many of those databases, we did not have access to them in Nigeria at that time.
Okay.
Yeah, so it was so one of the things I learned in my PhD was to for people that wants to move from a particular country to another very different, they should move early. right?
Okay.
Because I had a lot of things to learn. So while my
Okay.
colleagues, for example, those that came from mainland China, those that are in Hong Kong, they already knew these things, right? They already knew all these things. So I had to really sit down to learn them from the scratch. So I have a lot of opportunities to learn, and in Hong Kong we had access to various resources. I think the library, the librarians are there to actually support us and give us all we need. And the lecturers the professors are super supportive too.
Yeah.
So this gave me an opportunity to be exposed to doing research and knowing how to navigate a lot of software. I learned how to use Revman for meta-analysis. I learned SPSS the deeper way. I learned how to use NVivo, for qualitative research.
Wow.
Yeah, for qualitative research. I learned a lot. And one of the requirements to actually graduate from my PhD is after writing the thesis, I wrote a thesis of 11 chapters. And after that, you still need to publish in two peer-reviewed journals, and which has a very high ranking. So that also exposed me to submitting a paper, a manuscript in a kind of journal like that. I was from Nigeria. I've been exposed to submitting manuscripts to other journals with low impact factor, but for the first time I had to do this, I faced a lot of rejections, right? And to bring the paper up to the taste of such journals. So this actually is a big opportunity for me. It also gave me an opportunity to also be able to navigate grants. So I told you
Okay.
about development of the mobile application I did. I needed further funding, more funding for that development. Many of my colleagues did not really go that route, so it was just easy for them. So eventually, I had to search for more grants, and I remember applying for the Oncology Nursing Foundation doctoral scholarship, and I got it. And it was, yeah, thank you. It was really a major one for me because this was the major funds that really supported the app developments and other things around the randomized control trial that I did in Nigeria. So another opportunity for me was the opportunity to also present in various countries, right? During my PhD, I presented at 3 conferences, uh, four actually, one in Hong Kong, okay, two in, I mean, maybe five or even more, yeah, two or three in Hong Kong, right? One in Canada, though virtually, and the last one was in Japan. So I
Oh.
was, yeah, that
So
was a
you
major highlight also for my PhD. I moved to Japan for like 3-4 days for the conference. I saw Asia from another different perspective. Yeah, so these are some of the benefits I've derived. And also, a friend of mine mentioned something I found very insightful. He said, for people in Nigeria, that is just an opportunity that you need. When you get one opportunity, one global opportunity, it's going to open you up to many others. Right during my PhD, this friend of mine that I also talked about in my first year, she shared an opportunity with me for nursing leaders globally that are interested in being trained in policy. The ICN, International Council of Nurses, developed a program called the Global Nursing Leadership Institute, right? So she told me that I can apply for the funding, and I got it. So I was part of the 29 scholars that were trained by the ICN globally in policy. So after I finished that, I now got certified as a global nurse consultant by the ICN and CGFNS. So these are some of the benefits. There are actually much more. But let me
oh,
just highlight those few.
I can imagine. I mean, it sounds like, and I've experienced similar, but coming from a different position because I'm not from a low to middle income country, but
Okay.
where like being in Norway and even like being in the UK, just like the how different cultures, how different languages really affect how people view their health, how they interact with healthcare professionals, all that sort of stuff. So
Mhm.
I get that much of it, but your experience sounds incredible, Domi, like so incredible. Right.
Yeah.
I'm conscious of the time and it is slipping away very, very rapidly because your experiences are just so interesting. So your research, I want to go and highlight and talk about that a little bit. So you are very interested in digital health, and specifically around female experience with breast cancer. Can you tell me why breast cancer?
Yeah, thank you so much for that question. I also got registered as a midwife in Nigeria.
Okay.
Yes, so and I've been exposed to working with women, and also I got exposed to oncology nursing while working in the hospital back at Lagos State University Teaching
Hmm.
Hospital in Nigeria. So my experience with women with breast cancer, I got to know that Nigeria is one of the countries with the highest rate of breast cancer in Africa and even in the world, right? So I started looking for a means to do research in this area and also to provide psychoeducational support for these women because evidence suggests that many of them, while passing through this phase, they have a number of psychological issues, right? So that's really inspired me to see how I can develop a mobile application that is nurse-led, right? That a nurse can actually provide consultation for these females and support them while they receive chemotherapy. Yeah.
Okay. So, just for everybody out there who may not be as familiar with that term you use, psychoeducation, what does that mean?
Okay, thank you. So psychoeducation is actually a blend of okay, we call it psychoeducational interventions. So these are interventions that actually combine educational interventions with psychological support. So it's like combining
Okay.
two things, psycho education.
Okay.
So I got to know that many of these women, during my systematic review, they have a lot of educational needs,
Hmm.
right? And coupled with the educational needs, they also have psychological issues. So my PhD was actually in three phases. The first phase was a systematic review to
Hmm.
test the effect of MLs, mobile health interventions, on
Hmm.
psychological issues. So the second phase was a qualitative study
Hmm.
where I explored the experiences of Nigerian women with breast cancer along the lines of the psychological issues they have, their educational needs, and these actually provided the evidence to develop the mobile application.
Okay. Um, Thank you. That helps. It's just sometimes people say the same word but mean different things, so I just like to have a bit of clarification. Okay, so for you then, it was your actual exposure to this population as a clinical nurse that has kind of made you really want to dive in and to explore their experience and ways of improving their journey through that very quite intensive
Yeah,
therapy being chemotherapy.
yeah.
Um, so what then, because you mentioned it as phase one of your PhD research, so why did you decide to dive straight into a digital application versus, the more traditional like face-to-face interactions and nurse-led care?
Okay, thank you so much for that. During my master's at University of Ibadan, Nigeria, one of my professors, she worked on digital health, and our own research was around experiences of women, pregnant women. So she, at that time, mobile phones were not that common in Nigeria. So she pioneered that kind of research. So that actually exposed me to digital health. So I already had at the back of my mind that it's likely I will do something around that for my PhD. But now moving further to gathering the evidence, I noticed some things that actually propelled me further in this direction. The first is that Nigeria is actually one of the countries with the highest level of mobile phone usage in Africa.
Really?
Yes,
Okay.
yes. The internet penetration is good. Mobile phones are widely used and things like that. And I also found from evidence from a systematic review that this area is actually promising to deliver this psychoeducational support, which is why I chose digital health. And I also found from my experience in the hospitals that many of these patients during my qualitative study, many of them wanted the attention of nurses, right? They
Mm-hmm.
wanted more attention, right? Beyond what they were receiving at the hospital when they were at home. They did not want to just have a simple issue and they start coming to the hospital, right? So they wanted a means to be able to talk to the nurse from the comfort of their rooms. So this actually propelled me further in this direction.
Oh,
Yeah.
you and I need to have a much more detailed conversation outside of this because
Uh,
your research, although completely different populations,
okay.
um, aligns with so many things that I'm quite interested in,
Wow. Wow.
especially around digital health. So very, very quickly, and I'm going to try and hold myself back here because otherwise we're going to be here all day. Is You mentioned something there that made my ears perk up, is that you discovered in your qualitative research that your patient population, these women with breast cancer, were very keen to have a higher level of healthcare interactions beyond what our healthcare system actually, or your healthcare system actually provides. Having been in Hong Kong, and although I know you haven't been in Canada that long, do you think that that desire for a higher level of healthcare contact through a very traumatic illness and treatment journey, do you think that's unique to Nigeria, or do you think actually that's probably more global than what we realize?
Yeah, I think it's more global. It's more global. Nurses spend a lot of time with the patients. We are the patients 24 hours, right? So different studies have shown that patients actually want to be closer to their nurses. They want to be able to interact further with them. So from my experience in Hong Kong, I think it's actually the same, and literature actually also supports that. Yeah.
Hmm. I find it fascinating because I find our because of the increased demand on our healthcare systems as populations grow and as those populations live longer and have more chronic illnesses,
Mhm.
the amount of available time on nurse to do that face-to-face interaction is getting smaller and smaller,
Yeah.
but the
Yes.
demands of the people is growing larger. And that's why, like, the more you talk about your research, the more I'm like really interested, because
Oh.
I think it's a massive untapped potential of digital technology as using applications, interventions to help provide that higher level of support to
Mm.
more people without necessarily needing human nurse dedicated one-on-one time. It's a way of sort of like upscaling what we do as nurses.
Yeah, that's true. That's correct. Yeah.
Well, that's what we think anyway. Whether or not
Yeah.
it's what other people think,
Yeah,
what?
it's possible. Yeah.
Ah, the PhD skeptic in me can never let go. Very cool. So, from the sounds of it, then you have learned quite a few different research methods.
Yeah.
So systematic review, qualitative, and you very briefly snuck in there a randomized control trial as well.
Yes, yes.
You're like, oh yeah, I did that as well.
Wow, interesting.
No, I didn't. I'm saying you were like,
Oh,
oh
okay, okay,
yeah, the
okay.
RCT I did.
Okay.
So do you think, as part of researchers' education, it's an important thing to expose yourself to is like lots of different methods or types
Yeah,
of research, or do you think it just was what worked for your project?
yeah. Actually, in Hong Kong, the PhD system in Hong Kong is such that they want researchers that come from that university to be able to go around the world to impact the world. They want their products to be well rounded in different methodologies. So it's actually a culture in Chinese University of Hong Kong and that's the School of Nursing that their students are going to do exposed to these different methodologies. For me, that was what I wanted. Really,
Mm.
I wanted to
Mm-hmm.
learn. I wanted to be a figure in nursing that when you talk about different areas of research, I can have something to say, I have something to contribute. And I'm also a big fan of mentorship. While I was
Mm.
in Hong Kong, one of the things I was also doing actually supporting a non-governmental organization we started in Nigeria. I belong to a group of nurses called Fellowship of Christian Nurses, and
Mm-hmm.
we started an institute called the Institute of Nursing Research in
Mm-hmm.
Nigeria. So one of the things we're actually passionate about is providing mentorship for nurses along their research journey.
Okay.
So I've been exposed to various nurses that will ask me different questions. They want clarification about this area, this area, this area. And I'm so happy that I'm able to provide guidance from them because I've been exposed to these methodologies. And I also had it at the back of my mind that I don't know what is going to be operational where I'm going after my PhD. I'm not sure the kind
Mm.
of research they'll be doing. So I don't want a kind of exposure that will limit me not from being able to access some other opportunities. Yeah.
So inspiring.
Thank you.
So
Thank you.
inspiring. And I think like from my perspective, like it's so nice to have a conversation with somebody else who is trying to cross different borders. And I love that you're still maintaining your connections back in Nigeria,
Yes.
and that you're trying to, from what I'm hearing anyway, you're trying to be that friend who went before you in order to help other nurses from Nigeria follow the pathway. So it's I think in the business world and in the leadership world, they call it like lift as you climb
Yeah.
as a phrase where, it's not lift and shove the next person down. It's actually keep, and the more people that you lift up, actually, the more, not necessarily just higher you go, but the more you gain richness because you're going to have learning from mentoring, from supervising, and from actually just listening to other people's stories as well. So I really love that about what you're doing. That's really
Yeah.
cool.
Yes. Thank you.
So, um, for everybody out there who's listening, what would you, who's a nurse in training, no matter where in the world, because this does go out globally, this podcast, um, what would you say to a nurse who is what I would class as research curious? So they're not like you, where they had that, huge advantage of lecturers who kind of had introduced them to it, who showed them the way, who were doing that dream job that you're now trying to establish. What would you say to those nurses who are like, they've listened to this podcast and they're like, oh my word, that sounds amazing, but I don't know anybody in my world who's doing that? What would you advise somebody who's research curious but doesn't know the next steps to take?
Okay, thank you so much. Very brilliant question. The world has become a global village. And I would advise such nurses to utilize the opportunities they have through the internet, through social media. I get a lot of messages from my various social media platforms from nurses all around the world that are interested in building their capacity, their competencies as far as research is concerned. So I will advise such nurses to actually reach out, look out for nurses that are in the area. And I tell my students back in Nigeria and also in my various mentees, I actually emphasize this for nurses. It's important for you to realize that field that you want to actually work in nursing, to actually live and actually make impact in. And it doesn't have to be research in various different areas. And the next thing is to look for people that are doing so well in that area and reach out to them for mentorship. That's one. So secondly, my second advice will be believe in yourself, right? Along the research journey, one of the questions I've always asked myself, can I really do this? Because when I got to Hong Kong and I was exposed to a different kind of higher level of doing research and all, and wow, this is really demanding. And that was where this sentence came from. It just came up in my mind, and I've been telling nurses that ever since. Believe you can. If you don't, you will not start. If you start without believing you can, you will soon stop.
Oh,
Let's take that
say that
again.
one more time. That's beautiful.
Thank you. Believe you can. If you don't, you will not start. If you start without believing you can, you will soon stop.
Oh, that needs to go on a t-shirt, damn it. That is, whoa, that is,
Yes,
oh, I
yes.
love that. Thank
Thank
you so
you.
much. That's brilliant advice. I
Mm.
think with that, unless there's any other pearls of wisdom you want to impart on us, I think I'm going to wrap it up because I think you can't top that. I mean, that just, it is such a perfect way of describing your pursuit as a nurse researcher. It's yeah. So for I'll give you a chance. Do you have anything else that you want to share with everybody?
I think that's all for now. Thank you.
For everybody who's listening, if you're new to the podcast, Dami has very kindly given us all of his connections on social media. They'll be in the description of the episode, along with some of the research, so you can get a bit better of a flavor. I mean, he's given us the highlights of what some of the work that he's done, but you can actually dive in and read some of those papers, and then you'll be able to know whether or not he's the right person to reach out to or somebody else. Make sure if you're listening that you like, comment, and subscribe here on YouTube. I use the comments on the YouTube videos as the best way to channel questions to Dame specifically. It just makes it a much easier place for me to keep track of them versus all the different social media platforms. So do pop a comment down below if you have a question for him, and I can make sure that it gets directed to him. And yeah, thank you so much, Dame, for joining. I have found this conversation so inspiring and so interesting. It was a very, very, very wonderful pleasure to meet you. And yes, thank you very, very much for joining me.
You're welcome. Thanks for having me. Yeah.
My pleasure. Bye.
Okay, bye.
Don't go away. Up next, we have the top 3 takeaways from this week's podcast by Dr. Rosalind Austin.
One of the things that I'm coming to love about doing this podcast is how it is encouraging me to reach out to people who I didn't know professionally in my own journey as a nurse researcher so far, but people who are popping up on my social media feed, or people who are coming to notice through various different channels that I have about the research work that they're doing, regardless of where they are in their world. I didn't today was the first day that I actually met and had a conversation with Dame as we did the interview. And leading up to it, I was a little nervous, but I was also really, really excited because he has moved to so many different countries in order to progress his research career. And here in the UK, we have such an amazing structure and support that allows you to develop as a researcher without leaving your home or your country. That it's a different and unique journey that I really wanted to explore because, as some of you may or may not know, I've kind of been crossing a few international borders myself. And so I wanted to hear what it was like for him. And yeah, just out of curiosity to see how it went. And I'm so glad I did because I ended up being so inspired by his bravery, his journey, and just how much by his networks and his connections, and also by him being brave and reaching out to different opportunities in different places, he's been able to progress his career, and how he's now paying that forward to other people back in Nigeria and other nurses that he is now connecting to worldwide. So yeah, it was a really, really inspiring episode for me personally. I hope you've enjoyed it as well. Let me know in the comments what you think of his journey and whether or not you've done something like that as well, because I'd love to hear more about other researchers out there who are crossing international borders in order to progress their career. So, top takeaways for me today with him. The first one is I loved how for him, research as a nurse was never a question. It was, he described it, I loved how he said it, questioning the question as a trait of who he was, and how he then, throughout his education and throughout his developmental, watching his parents and what his parents did, and then connecting with lecturers at through his nursing training who were doing what he wanted to do, he found a continual source of inspiration to allow him to develop what he feels is that natural curiosity trait that was within him. And I think, having people like that in your life is so inspiring. And I, reflecting back on it, possibly I have that trait as well. But for me, it was much more of something that I came to slower, that I didn't know that such a career existed. I didn't know that you could follow this pathway. I didn't know that you could become a nurse researcher. And it was a slow, gradual progression as I bounced around doing various different degrees. Maybe I'll do a special episode where I tell you my research journey. What do we think? Thumbs up? Thumbs down? Do you want to know? Anyway, so for me, I think top takeaway is that actually that curiosity we keep talking about, it can be a trait. And for him it was, and for some of our other guests it was as well. But I think it also can be a skill. And it can be a skill that you develop and hone. And so I think that's an important sort of to for me treasure and keep close to my heart. Second top takeaway is his desire to be a researcher at a global scale. And I say, like, game on. Like, that's so brilliant. I think sometimes within nursing or within non-medical professionals, we want to do research and we start to explore it, and we're quite excited and happy when we get to like national level. And his passion and his fire for becoming like a global research leader is, really inspiring. And I hope it inspires you as well, of being somebody who is going to be changing and influencing policy and evidence, not just locally where he is, but upscaling it to have a global impact. And I think embedded in that is his journey to be brave and to reach out to current top leaders and to be brave and cross borders in order to increase your skill set, increase your networking, increase your training levels, so that you can become that recognized global leader in research. So yeah, it was really, really inspiring of how for him, it's a planned, purposeful journey where and he's consciously pursuing. So yeah, top takeaway number 2. Top takeaway number 3. I'm not gonna try and remember off the top of my head that quote that he ended the podcast with.
Believe you can. If you don't, you won't start. If you start without believing you can, you will soon stop.
I loved that so much because I think the research journey, and we've talked about this in previous episodes, can be fraught with challenges. Potential lack of existing clinical academic career pathway, multiple jobs across multiple institutions. We haven't even really started talking about all the rejections that you face, and he kind of started to mention some of them there around, rejections of publications, rejection of conference abstracts. Like, it can be a really, really challenging environment in which to thrive. And his reminder to believe in you and to believe that you can, because if you believe that you can, then even when it gets tough, you'll have that inspiration, that golden nugget in the deep of your belly that will push you through that challenge. And I think that's such a core thing that we all probably need to work on. I know I do, of you can do this. And even when it's hard, you can achieve it. So yeah, those are my top 3 takeaways. So question the question, curiosity as a skill as well as an innate trait. Become a global leader. Don't hold yourself back. And following swiftly onto that, believe in you and the power of can. Thank you so much for listening to this next episode. I hope you found it as inspiring as I did. Definitely thank you for everybody who has been subscribing, who's been liking, who's been commenting, whether that's on the social media platforms where I post about the episodes or whether that's on the actual episodes themselves. That is the best way of making sure I see your comment, is to put it on the YouTube video, especially if it's a question you want to direct to any of the guests. Drop it in there and then I can field it and get you in touch. Also remember, do dive into the episode descriptions. I put quite a lot of information in there around the guest, their bio, how to contact them, their research, the book that they're reading, all of those details. So yeah, dive into that, and I hope to see you again soon. Thank you so much for listening, and I will see you again in 3 weeks. Bye.